What is fetal alcohol syndrome? Why alcohol is dangerous for your baby? Fetal alcohol syndrome is a severe, irreversible medical condition seen in children whose mothers had alcohol exposure during pregnancy. Fetal alcohol syndrome is responsible for malformation, brain damage, and growth problems. No quantity of alcohol is safe to consume during pregnancy. If you are pregnant or plan to have a baby, keep away from alcohol. Otherwise, you will be placing your baby at risk of fetal alcohol syndrome. It is important to note that alcoholic beverages include not only hard liquor, but beer, wine, sweets and chocolates with alcohol as well. Any trace of alcohol in a pregnant woman's bloodstream will pass to the developing baby, the fetus, through the umbilical cord. Fetal alcohol spectrum disorders, FASDs, refer to a group of conditions that can occur in a person whose mother drank alcohol during pregnancy. These conditions can include physical behavior and learning problems. Often, a person with an FASD has a mix of these problems. There are 3 types of FASDs: fetal alcohol syndrome, FAS, alcohol-related neurodevelopmental disorder, ARND, and alcohol-related birth defects, ARBD, or alcohol-related congenital disabilities, ARCD. Signs and symptoms of fetal alcohol syndrome in children. Physical defects may include distinctive facial features, including small eyes, an exceptionally thin upper lip, a short upturned nose, and a smooth skin surface between the nose and the upper lip. Deformities of joints, limbs, and fingers. Slow physical growth before and after birth. Learning disabilities and hyperactive behavior. Difficulties in school, speech, and language delays. Low body weight, vision difficulties or hearing problems. Difficulty with attention, poor memory, and poor coordination. Central nervous system damage or problems with the brain may include poor judgment skills, jitteriness or hyperactivity, intellectual disability, learning disorders, and delayed development. Trouble with attention and processing information. Difficulty with reasoning and problem solving. Difficulty identifying consequences of choices and rapidly changing moods. Social and behavioral issues. Problems in functioning, coping, and interacting with others may include poor social skills, poor concept of time, problems staying on task, trouble getting along with others, difficulty planning or working towards a goal, problems with behavior and impulse control, trouble adapting to change or switching from one task to another. Can an alcoholic father cause congenital disability? Yes, new research evidence suggests a link between paternal alcohol consumption before conception and the chances of fetal birth deformation. Fathers who drink alcohol regularly are associated with greater chances of producing children with congenital disabilities, like congenital heart disease, limb anomalies, clefts, and digestive tract anomalies. Causes and risk factors. If you are pregnant and drink alcohol, the following are your risk factors. Alcohol in your bloodstream reaches your developing fetus through the placenta. Blood alcohol concentrations rise in your developing baby faster than in the mother's body because a fetus metabolizes alcohol slower than an adult does. Alcohol interferes with the delivery of oxygen and optimal nutrition to your developing baby. Exposure to alcohol before birth can cause severe malformations and permanent brain damage in your baby. If you drink during pregnancy, the greater the risk for your unborn baby. Any amount of alcohol puts your baby at risk because your baby's brain, heart, and blood vessels begin to develop in the early weeks of pregnancy, before you may know you're pregnant. The health advice is, do not drink alcohol if you think you might be pregnant, if you are trying to become pregnant, or if you are pregnant or expecting a baby. Prevention. Experts recommend that fetal alcohol syndrome is entirely preventable if women do not consume alcohol during pregnancy. If you have an alcohol problem, Get help before you get pregnant. Get professional help to determine your level of alcohol dependence and to develop a treatment plan. If you plan to adopt a child, remember to check for the mother's alcohol consumption history. If you adopted a child or provided foster care, you may not know if the biological mother drank alcohol while pregnant. Since early diagnosis may help reduce the risk of long-term problems for children with fetal alcohol syndrome, contact your child's doctor in time to check an FAS. Do not wait for problems to arise before seeking help. We publish great new health videos on this channel every week. If you like our videos, please subscribe to our channels now to get our latest videos weekly.